Good day. This is the Worldometer site, where global population statistics alongside coronavirus statistics are reported. It's very easy to navigate, and it has a lot of useful and interesting statistics to look at. In this video, I will try to go over some of the figures, show you some of the charts there, and add some commentary to them. Here, we see the global figure. Total cases reported are north of 6 million now. The deaths and recovered figures are on this page as well. If you scroll down, there's a list of countries ranked in the initial look in number of cases, starting with USA, which has around 30% of the global cases with 1.8 million. Brazil with 469,000 comes second, and the increase in the number of daily cases have been very fast in Brazil. We will look at the individual countries later. Third in place is Russia. Russia is 396,000. Fourth is Spain, that is pretty much in control of the epidemic, with 285. Fifth is UK with 272. Italy 232. France 186. Germany 183. India 181. 10th is Turkey 162. The next 10 starts with Iran, 148,000 cases. Peru 12, 148 again. Chile 94. Canada 90. Mexico 84. Saudi Arabia 83. China 82. Pakistan 66. Belgium 58. And 20th is Qatar with 55. Of these countries, it's interesting to look at the proportion of total cases to total population. So for a second, if you could just scroll up, look at the population stats globally, and look at the world population. It's 7,788,000,000. So if you take like 1% of this population, we're talking about around 78 million people. If we click back to coronavirus, we're less than 1/10 of 1% in the global cases. So globally, we're very far away from herd immunity, as well, at least the reported cases are not substantial in number given the world population. But the experts believe that the total infections are a lot higher than the reported cases. So in that light, we could be looking at something closer to 1% of the global population, but still no more. Of the countries with the highest number of cases, just a casual glance in the top, let's say 10, shows that none of these countries have around 1% of their population infected. If you go to countries with smaller populations, for example, if you go to Qatar, which is 20th on the list, the population is 2.8 million and the infected is 55,000. That represents approximately 2% of the population. Just to check this and put it in perspective with countries that are close to Qatar, for example, we can look at Saudi Arabia, that's 16th on the list. With its 34 million population, 1% infection would have been 347,000. Well, Saudi Arabia is like 1/4 of it. So compared to Qatar, Saudi Arabia is on a total infection ratio at a very... it's very hard to say whatever is better, but the infection rate is lower in terms of population. Let's try to scroll down and see other regional countries. For example, United Arab Emirates. With its 10 million population, a 1% infection rate would have been 100,000. Well, it's 1/3 of it. So Qatar seems to stand out in the region as well. Just let's look at Kuwait. Kuwait is close to 0.5% of our population, 4.2 million, infection of 26,000. So given this, if we go back to our main list to see if any other country is in the top 20 close to 1%, we'd see that, for example, Belgium is close to 0.5%, or pretty much, for example, Peru is close to 0.5% as well. But the rest is around 0.2 to 0.4% of the total population. That's pretty much similar across the board in these countries. For example, if you look at the leading one, which is the United States, total infected is around 0.6%. But can we say these figures represent similar conditions? Probably the only way to compare the conditions of discovering infections is how many tests are being done. On absolute numbers, total tests, if you use the table to rank them, the countries with the highest number of tests go from USA, Russia, UK, Germany, Italy, and down the list. But that number of total tests by itself is meaningless unless the comparison is made as a percentage of the population. So if you click on that tab, here what we see is tests per 1 million population. The highest is for Gibraltar, which has a population of 33,000. And they've done only 7,000 tests, but that's pretty much 1/4, one fifth of the population. Here, 2024, 224,000 tests per 1 million population for Gibraltar means that they've done approximately 22.4%. So say 22%. If you go down the list, the countries, the top 10 countries with the highest ratios have all done north of 10% testing in their population. Please be mindful that any test that's shown here, or for any other country, and if I'm not mistaken, only a very few number of countries report the unique number of people tests have been performed on, could be double testing for the same patient, or multiple tests for like healthcare workers or other high-risk individuals. So to clean out the test number, we have to take out a certain percentage, and the remaining number could be the unique number of tests performed. I haven't seen any research on this, but I mean, on a very practical level, in smaller subsets, it could be like 1/4 of the tests are done double tests or triple tests for the same person, and multiple testing for the high-risk workers. But even though this risk remains on the unique number of tested, total number of tests is a good indication if it's compared to population levels. Given that all these countries, and if we extend the list, look at the first 20, many of them are smaller countries that have done north of 10% testing. 20th in the list is Russia, and Russia is one of the most populous countries on the globe. It has 145 million population, and it has tested 7% of it with 10 million tests. It's a pretty impressive feat. Another country that is of significant population is Spain. Spain comes 17th on the penetration of tests. It has tested around 8% of its population. After Russia and Spain, on the list is Belgium, which has 11 million population, and again a 7% testing rate. After them comes United Arab Emirates. Out of its 9.8 million population, it has done 2.1 million tests, so it has done 21%. I mean, it's a small country, but not tiny, and 21% penetration is huge. I mean, that's probably a factor related to being relatively rich, but then again, not every rich country has done that much intensive testing. Anyhow, it's probably both being rich and also being small. We should not forget Portugal with 10 million population and 8% testing as well on this list. To remind you, by the way, these couple of bigger countries like Russia have not been testing very actively in the early stages of the epidemic, of the pandemic more accurately, but they have caught up later on. Anyway, let's go back to the total cases list and look at what have the countries with a lot of cases done. So let's go with the US, 5%. Then we go to Brazil. Brazil has only tested 0.4% of its population. See, this is strange to look at the table and to see Brazil with 469,000 cases, but only 0.4% testing. For example, Russia, which is, I mean, pretty much similar to the number of cases that Brazil has tested 16 times more than Brazil. So the question becomes, if Brazil had tested 16 times more, which would mean like they would have done 15 million tests instead of a million, would they find 15, 16 times more cases? Would we see like 7 million infections in Brazil? Probably not. The reason for that is, like many other countries, Brazil is testing those patients, those with symptoms that come to the hospital, that report that they have a problem, and since they're pretty much already in high risk category of being infected, the test results are mostly positive or relatively more positive for such, let's say, patients. I mean, you could see it in the total tests to total cases ratio, which is not there. But if you take 930 and compare it to the total cases are 50% of the total tests. In the US, this figure is 10% or 11%. In Russia, this figure is only 4%. So Brazil is basically testing the sick. If you do test the wider percentage of the population, number of infections would obviously rise. I mean, probably Brazil has a lot more than 500,000. But then again, it wouldn't be multiplied by 15 or 16 times to catch up with USA or Russia. If you go down the list to look at other countries, in Spain, we see again 8% testing, UK 6%, Italy 6%. France has not done a lot of tests. I mean, in bigger European countries with a high case count, France is like 1/3 of the previous ones I cited, and since most people assume Germany has done a good job, France is half or less than half of Germany, which is with Germany's around 4.7%. So when we look at France individually, or let's just quickly glance at France. See, in their daily new cases report, early March, the infection starts to pick up. In mid-April, it peaks in the number of cases. If we look at the active cases, in late April, they reach a peak. Worldometer reports active cases as infected minus deaths and minus recoveries. So pretty much that's the number of actively infected reported people in that country or in the region that we're looking at. In this slide, France's case numbers in late April and early May start to fall down to around 1,000, and during May it goes around a couple of hundred per day. But the thing is, be mindful that France is not testing enough compared to other countries that most of the countries that we have mentioned so far and some of the other European countries. So just proportionally, if it would do double the amount of tests it's been doing, this relatively few number of daily cases would probably increase a bit. Would it change the trend? I doubt so. Anyhow, let's go back to the previous table and let's go on with the test penetration. Germany's again close to 5%. India has been reporting cases pretty much later than its, let's say, neighboring countries or its region, and definitely later than European countries and the States. And its testing is 0.2%. It's very limited in a country, in the country that's the second biggest population after China, 1.3 billion people in India. Its case count is rapidly increasing, and we could say it's like 5% of the total tests turn into infections in India. Given a huge population, possibly the scale of the infection, unless it's contained in certain cities, which I haven't looked in, could be a lot bigger. Turkey has done 2.3% testing, similar to France. Iran has done 1%. Peru and Chile have done all 3%. Canada is 4.3%. Mexico is pretty much like Brazil. It's 0.1%. It has a very sizable population of 128 million. Of the 244,000 tests it has done, 1/3 have turned out to be infected. So we're seeing the Brazilian example here, where testing is done to the incoming rather than out in the field. Just if we could slip back for a second to Chile and Peru, which have significant numbers. In Peru, the ratio of cases to total tests is around 15%, and Chile it's around like 18%. It still seems that these countries are also swamped under the incoming patients. They're doing relatively better than Brazil and Mexico, but still high. Saudi Arabia has a low test number, given its wealth and relatively low population, 2.3%. Pakistan has done a very, 0.2, very limited number of tests. Belgium, as we mentioned, high, 7.3. Qatar has done significant, 7.5% testing, and it has found 1/4 of its tested population to be infected. Here, if you could just pause to look at a correlation here. We have a couple of countries that have done around like 6-7%. Let's look at their total case to testing numbers. So in Qatar, 55,000 to 217 being tested, 1/4. Okay, 25%. In Belgium, again, it's a 7% testing country. It's around 7%. I want to remind you, in Qatar it was like 25%. In Belgium, it's 7%, 8%. I mean, I'm just giving approximations off the top of my head when looking at the figures now. In Italy, it's 6-7%. In UK, 6-7%. In Spain, 6-7%. In Russia, 4%. Well, in the States, 11%. So many countries fall into this range of 6-7% total case to total test. US has a higher figure, which I would presume not only shows the rate of infection spread, probably it doesn't show that. It probably shows that incoming patients is relatively higher than the capacity to go out on the field and test them. Russia is a case example of rapid test deployment and testing a wider sample of the population, and as a result its percentage is lower. Why Qatar has such a high percentage? You could only speculate that the infection might have spread much more intensely in Qatar. I mean, I lack specific information, but Qatar stands out on the high side of this total case to total test ratio. But I don't want to talk about the mortality figures, as I mean there are a lot of experts and perfect articles on this. There's a great article in The Economist that lists the most important factors such as age, obesity, smoking, cancer, organ transplant, etc. certain aspects. But it also reports a very, very sad figure that most of the European and the US deaths have come from long-term care facilities for the old. So pretty much the death figures are skewed to the upside in countries where elderly have been sort of separated from their core families and living in segregated, regardless of the quality, I don't know whether they're good or bad, but segregated, separate care facilities. In Turkey, where I reside, in Russia, in countries where this has not been the norm, the death figures are considerably lower. It's not only because the population is younger, it's the social fabric of where people are residing and how they're living. Also, for example, in Turkey, I think a very effective preventative measure was to isolate the old inside their homes and curfew them, basically. Even though that's a very harsh measure, Turkish elderly still live with their families and family networks are strong. So nobody actually would starve to death, plus there's the government support. But in a situation where the elderly had already been in care facilities, such as in Netherlands and Belgium, some in the US and in Italy, in France, the majority of the deaths came from those facilities. So if you could just very quickly look at the mortality ratio to total cases. In the United States, what we see is close to 6% mortality. Brazil has like 6%, but it still is early on in reporting, so might not be comparable. But if you look at Russia, even the pickup there is still is in an earlier stage, probably compared to the other European countries and the US. It's 1.5%. The figure is like 9% in Spain, more than 12% in the UK, close to 14% in Italy, 15% in France, and even in Germany, which is again deemed to be very successful, the percentage is 4%. It's less than 3% for Turkey. It's close to 5% in Iran. And looking at, for example, in Qatar, where there's a huge number of infections, there's virtually, no deaths. 36 out of an infection of 55,000. So the factors that play into this issue are a bit complicated, but the divergence among countries in the number of infections leading to deaths is significant. Now, an interesting data can be found in a country level figure, but just allow me a second to show you the global graph before we do that. And here there's this distribution of cases as a percentage you could find. Here's the total cases globally, but what's more important is to look at daily cases. And you see the pickup starts, this is after China pickup, for all the statistics here, it starts mid-March, rapidly increases to around 100,000 cases per day, and that 100,000 cases per day lasts from late March up until now. There's a slight positive trend in this graph, you could see. It's just sort of increasing, and in the last couple of days, the highest 2 consecutive days of daily new cases have been reported. To see if the global control of the pandemic is in place, we should look at the active case figure. Active cases is, as I've mentioned, what Worldometer arrives at by removing deaths and recoveries from total cases. It's what they call currently infected cases. And that figure is around 3 million as of today. So to remind you, total cases 6 million, active cases 3 million. Let's jump from this graph back to the country level. And let's look at countries before the US who have managed to contain the virus, even though they suffered significant amount of deaths and problems to start with. One of them is Spain, and you would see that total cases, daily new cases have peaked, within a month, less than a month actually, and have been falling steadily. But it's more important to see the active cases graph. So here you see early March pickup and mid-April plateau. So it has taken Spain around a month to control the infection. If you go to the higher, this daily new cases graph, and check what's happening in these April 15 to 20 period, Spain is getting 4,000 cases per day. So why is this active cases falling? Because there are recoveries. And the graphs and all the figures are showing sort of like the light traveling in the space. It's a picture from 15 days ago. So if you are able to curb the disease, the previously infected will still show up. But after like around 7 to 15 days, if there are no new infections, daily new cases would zero out. So once you start to see a decline in the cases and see some recovery here in the active cases, you pretty much get a sense that the top has been reached. which was the case for Spain. But there's a caveat. This, long-awaited high-risk second wave issue. So with Spain, daily new cases are not spiking, but they're like holding steady around 1,000, just a tad bit below. And as recoveries have already taken place, the active cases are increasing slowly, which means that there's a new supply coming here. Would it pick up? Would this number increase? We'll see, and we'll talk about that in the Iran example, where we have some preliminary data that could be somewhat cautionary for other countries. Let's go to Italy. Italy has suffered significantly, just as Spain. And look, let's look at the same graph. Earlier on than Spain, so like 10, 11 days before, earlier March, late February, Italy figures come, and they pretty much stabilize around late March. Again, a month of increasing number of cases, and from then on, there's a very steady decrease in the number of new cases. But look, albeit at a lower figure of 500, there's a steady supply of new cases coming in. Similar to Spain, and this is going to be the graph in most of the countries that are able to control. The pickup is early March, and the top of the active cases graph comes sort of 10 to 15 days after daily new cases peak have been reached. And Italy has been very successful in controlling it. Thanks to very strict curfews. But then again, this is the result. Let's look at Germany. Can we see its success in these graphs? See, this is very interesting. The first time, weeks ago, when I looked at this, and I've written about that in the Medium in an article, you notice there is something different in Germany's graph compared to Italy and Spain. Let's look very quickly. Look. And this is Spain. The curves are less steep in Italy and Spain than Germany. In fact, Germany is steeper than in Spain and then Italy. Of course, this is not a perfect graphing. I'm talking visually here. Germany is obviously, very steep. What this shows is that, and look at the increase in daily new cases. This shows intensive early on testing capacity. Even though this reveals a high number of infected cases early on, it provides for the government, for the health authority, to control the epidemic earlier on. Because more of the spreaders are known beforehand. Whereas in other countries, like in Italy and Spain, it has taken a longer time. Just look at it from this graph. Longer time to discover. That was what I meant. Similar to, I think, Spain, early March, in Germany as well, early March. And Germany very quickly comes to 6,000 cases in late March. Spain initially is slower to pick up, then its curve steepens. Then Germany, given a intensive testing and a steep hike in active cases, manages to control most of the spreading and quite rapidly has a fall in cases. But look, even though its cases have fallen, it's still standing around 500. And its active cases are showing sort of bottoming out. We don't know how these graphs will turn out, but if we check with Iran. I think Iran is the risk that we should all fear about a not so well controlled second round. See, we come back to our case figures, total cases, daily new cases, slow steep, and then a higher step up, and Iran takes perhaps similar or perhaps just a tad bit longer to peak up. It's similar to Italy in timing, so a bit earlier than Spain and Germany. Peaks around 3,000 daily cases, and then it's under control. As you see, active cases in early April, Iran seems under control. Number of reported cases fall, active cases decline, and something strange happens. From early May, the number of cases, which had fallen to around 1,000, start to increase towards 2,000, and with 2,800 reported on May 29th. See, with these new infections, the active case figure gets very close to the top, and significantly above the low it has seen in early May. I mean, to give some background to this figure, this is the Ramadan period, and Iranian restrictions have been sort of loosened in May, and as the country got back to normalization, to its normal life, the infections have increased and daily new cases have increased, and this shows that normalization risks a second wave or a third wave or whatever wave. Recall that, if you could please go back to the global figures, we only have, let's look at from here, 6 million cases. Even if it's 60, 70 million, doesn't matter. The penetration is still very low. So with this lower penetration, any going back to normal would increase the number of cases. Would that drastically change the situation? I mean, I'm no expert to say, but the Iranian example shows that at least normalization would possibly mean new cases, and the level of normalization would have a positive correlation with the number of new cases. Anyway, if you go back to our list and to look at countries that could be interesting to examine, I think Brazil and Russia, which have started reporting way later than the others, are interesting to look at. Let's start with Russia. Look, where many of the countries we mentioned started reporting early March, it's approximately a month later that Russia is significantly reporting cases, and that's very, very limited number of cases per day. But as it picks up its testing capacity, increases testing capacity, I mean, mid-April until now, Russia has been reporting around 5 to 10,000 cases per day. Its peak has, in daily new cases have fallen, so it's not 11,000 anymore. It's around 8,500, but still is significant. It's one of the biggest contributors to the global case figures. But it has managed, with a lot of recoveries, to reduce the number of active cases. So Russia has a huge count, significant infection, but the epidemic in Russia seems to be under relative control. In comparison, if you look at Brazil, for example, it has started reporting similar to Russia in April, and pretty much up until late April it wasn't actively reporting a lot of cases. And since we know that testing is not done in Brazil on, say, randomized population checks, the first reports were probably people who came into the hospitals. So possibly in this April period, the number of infected were a lot higher. But Brazil is seeing everything from a sort of an even more increased, even more accentuated, backward-looking telescope. So today, as of yesterday actually, on 29th, Brazil was the highest contributor to the global case count. By itself, it has managed to contribute 27,000 cases, and its active case figure is at 247. It's compared to other countries have surpassed a month and a half and have not seen any topping out in its active cases. Brazil seems to be a significant underperformer in crisis management. No wonder health ministers have been changed. No wonder there's, local and global criticism of Bolsonaro's handling of the crisis. Compared to all the other countries in the top 20 infection figures, Brazil and Mexico stand out as two countries where healthcare measures have been too relaxed and the infection seems not to be under control. So let's look at the States, the global leader. Would it give us any significant insight into what's going on? First of all, thanks to Worldometer, we have state level case counts. So if you could recall, 1.8 million. Of that 1.8 million, 20% is in New York. So New York is the epicenter, but every country has an epicenter. In Turkey, we have Istanbul. In the UK, it's London. And for example, in China, we all learned it was the Wuhan province initially. The city of Wuhan, sorry. But New York is not alone. Around 9% comes from New Jersey, around 6% comes from Illinois, California comes with like 5%. So in the States, even though there are certain centers, the epidemic is also very widespread. Let's look at the daily reportings in the States. The cases start to come in, mid-March, pretty much similar to the Spain picture, for example, similar to Turkey's picture, for example. And the daily new cases very rapidly increase, from a couple of thousand to 35,000. The escalation in the States is higher. And from then on, even though there's a slow decline, it still is at 25,000. So every day, 20 to 25,000 new cases are being reported in the States. And the slowdown is a bit slow. And their testing is good, but could be a little bit higher. So this graph and this graph has a upward tilt potential. And it has not managed to keep the cases under control. So this was mid-March that they reported, and given other countries' example, especially in Europe, one would have expected that at least by mid-May and possibly earlier first week of May, the US would have its active cases under control. But on the contrary, it still is increasing. And I mean, even if the case count starts to fall from here, the top would have occurred somewhere mid-June. That's a very poor performance. But on a death level, the number of infected, albeit very high, the mortality rate in the States is lower than the European average. And while the United States have a bit younger population, I mean, I'm not 100% sure of the data, but compared to some European countries, it has a lot of, complications due to obesity and diabetes, which are important triggers in mortality. So I think US is sort of below the global average in fighting this virus, in dealing with this virus. Just as a quick glance, you mentioned that Qatar has a very low mortality rate. Let's look at Qatar's graph. Significant increase in cases. Steep active case graph. Don't forget that is not bad. It means quicker discovery. And recoveries are taking place. So I think this is a good example in looking at a country where there's a lot of infection penetration, there's a lot of testing, and control. You might be wondering, how would it look if we could find South Korea, which has been mentioned as, again, a success case in preventing this virus. And I'm very successfully unable to find South Korea in this list. Has it gone? Yeah, it has come down so much. It's 49th now, 48th now. Anyhow, let's look at how they've done. It's interesting. Look at their total cases. Look at the steepness of the curve. Look at this daily new cases. It's like the best on the globe. Very rapid testing, very quick discovery, and as a result, very steep active case graph and a steeper fall. How many people live in South Korea? 51 million. So mind you, this is a country with a significant population, with pretty much 1.7% testing, not that much, but those tests were done very early on. I think South Korea is a lesson in being prepared. We have to be prepared, test very quickly, test those who are not sick as well, to have an idea, quickly follow up on individual cases, so this contact tracing, and you don't have to shut down your whole country and still maintain to control the virus in a 51 million populated country. And death figure is also very, very low. 269 deaths. It's like, let's take 1% of their infected, it would be 2.4% death ratio. So this has been an overall glance at the figures. I don't know how many people this video will reach, but I can recommend the Worldometer site. It's very informative and easy to navigate. There are a lot of other sites with a lot of other good quality data, and I'm sure you'd find them useful as well. For my own follow-ups, I've used Worldometer predominantly. We pretty much see the infection is not under control globally, but many countries have managed to do good with this. I mean, I haven't clicked on Turkey in this video, but Turkey has done good in having its peak reached early on. Germany, as we have seen, the troubled European countries of Spain and Italy. We haven't looked at it, but France is under control as well. UK is not doing that great, but it's not reporting recovery, so we don't have a comparative graph, but it's reporting cases a bit higher than the European average. India is early on in the game, Latin America is early on in this fight, and US is probably close to topping sometime in June. But I mean, I was mistaken to think it would be in May. The first wave is close to coming to its peak, but we lack the information other than the Iranian case of how the second waves will turn out. In the Iran example, the second wave seems to be tough, harsh, high, but the South Korean example of a second wave is relatively small. Some people might mention the Singapore example, and I could very quickly show you Singapore. And you see that the infection is under control. There has been a flare-up in April, but the thing is that their first wave was very subdued. Singapore is going through its major epidemic a bit later on than usual, and it's due to migrant workers being infected and not being tested properly to begin with. But yet again, they've managed to put it under control. Excuse me, but let's very quickly look at Sweden before we end the video. Because Sweden has, compared to other European countries, compared to most of the globe, have been following a unstated herd immunity path. So its restrictions were a lot softer, but the public is educated, population density is low, and it's I think a very highly aware country of what it's been doing. But let's see how its low intensity fight stacks up against the other countries. So it has reported cases especially in mid-March. Similar to other countries, within nearly a month it has reported the highest number of cases, which is around 750. And from then on, it has around 500 cases reporting every day. But because the number of daily new cases are not coming down, its active cases are steadily increasing. And we're not seeing the epidemic under control in Sweden. However, it's hard to gauge whether this approach is on the whole more destructive or not, because I mean, if curfewing and locking up is the answer to achieving control, there's a significant damage on the economics and social fabric as well. Sweden might have avoided them at the cost of additional deaths, and it's a trade-off. I mean, none of us are able to qualify or quantify. But the more interesting scientific question would be to look at it a year later and to see whether the Swedish approach compared to countries of similar makeup have yielded same or worse results in both total infection and also in the death figures. However, further complicating this would be the fact that whether we develop immunity or whether a vaccine will be ready by then. So it's hard to draw a conclusion on this relatively relaxed choice that Sweden has made. I mean, I'm gonna be actively watching it. So if we go back to our global case, and here click on this logarithmic graphs of cases and deaths, even though the steepness is falling, even though topping up the top, reaching top could be in sight, we still are in a growth phase of the epidemic. But as I've said, the success of certain countries in curbing it, controlling it, should give everyone hope that it could be achieved globally. And it will be achieved globally when the subcomponents such as the States, the United States, Brazil, India, Russia, Peru, Mexico, or Pakistan, who are bringing in new case figures, now manage to control it. Well, thanks for watching. It has been close to an hour, and this has been my, I guess, second video in a couple of years, actually. I'm pretty sure that most of you are familiar to these figures, but I wanted to go over them in more detail, hoping that historically this might serve as a reference point or something to look at, maybe even years later from today, and this information presented in this manner could be useful for someone. Again, thanks for watching, and take care.